Hi, everyone. My name is Annette Gowron. I am a second-year pediatric resident at Nicholas Children's Hospital. I am a USMLE tutor for MST. I also do residency advising. I've been working for MST for many years, since 2017. I taught USMLE Step 1 to CK, and now I'm doing a lot of residency advising. Like I said, I'm in my second year of pediatrics. I took Step 3 recently. I'm applying for pediatric GI, and I'm living in Miami, Florida. And today, we're going to be talking about tackling the USMLE Step 3. So let me introduce you to my co-host, Neil Shah. Would you like to introduce yourself?
Yeah, sure. Hey, everyone. My name is Neil Shah. I'm a second-year resident at SUNY Downstate Medical Center in Brooklyn, New York, in orthopedic surgery. I've been working with MST for a little over a year now, predominantly doing residency consulting, anywhere from if you're day one and are interested in trying to think about residency or even what you may want to do, to all your aspects of your application. So excited to be here tonight.
Awesome. So let's dive in. Okay, so we're going to talk about Step 3 and the general format of Step 3. We're going to talk about expectations, how you should be studying, how you should be scheduling your studying. And so we'll talk about both if you're applying it or doing it before residency, where you'll have more time, and then once you're in residency, where you're a little bit more time constricted and have to schedule out your studying a little bit better. We'll discuss the CCS section, which is a part that most students kind of get a little nervous about since it's not something that we're used to. We'll kind of talk about a sample CCS case, and then we'll do a Q&A at the end, and we'll answer all of your questions. So type them along, and yeah, that'll be great. Alrighty. And so who are we? So we are MST. I like to call it a team. We're a family. We do one-on-one online tutoring, anywhere from before medical school, so like your MCAT, all the way through medical school, basically general coursework, Step 1, Step 2, Step 2 CS, Step 3, and even like board studying for beyond residency and applications for fellowship, and basically anything that you need. We have a tutor here for you, and we can meet those needs. And we have more than 14 years of success with students. Our family consists of medical students, residents, and attendings who have crushed the boards and love to teach. All right. So Neil, do you want to talk about what Step 3 is like?
Yes, absolutely. So this truly is a unique experience for you the first time you take it. It's great to know ahead of time that there are 2 days. You don't want to be surprised by that fact. So knowing what to expect is important. So if you do a little reading, you'll find out that Step 3, it's a 2-day test. The first day is about 230 questions. I believe that was like 7 or 8 blocks when I took it 2 years ago. This Foundations of Independent Practice focuses mainly on medical principles. Biostatistics and epidemiology is a big component, and we'll go into that in a little bit later in this talk. And then diagnosis. This portion feels a little bit more like the Step 2 CK format from my experience. You're sitting answering questions and you're in that mode. Day 2 mixes it up. It's also good to know that you do have a significant number of blocks of questions this day, not just cases. So be prepared for that. A little bit shorter, 180 multiple choice, and then the 13 CCS cases, which we'll talk about. This is advanced clinical medicine, so this is more about the next step, not just diagnosing, but what do you do? What does your treatment management imply or lead to? So prognosis, management plans, and then preventive medicine. So things that you should start thinking about as a physician, not just getting the diagnosis and getting the right treatment. And the CCS cases are an interactive, unique component that we'll talk about a little bit more.
So, and just one thing to add, I don't know if you'd agree with me, Neil. I felt like day 1 was a lot tougher. Like it was kind of like the CK, like you said. and there was a lot of biostats. And then day 2, the questionnaire, the multiple choice questions seemed like a little bit more like step 1 and like more diagnosing management, and seemed like a little bit more straightforward.
Yeah, I think everyone's experience is. I felt the opposite way. I think I took it before residency started, so I think some of that being connected with it and seeing it every day, I
Right.
felt a little more confident in day 1 than day 2, and I think that's important to know what your background is, what your strength is for this test.
Exactly. And then also day 1 has a lot of drug ads that you have
Oh,
to
yes.
remember. Yeah. And luckily UWorld has a bunch, when we'll talk about resources in a little bit, but it's one of those things where it's not as easy to prepare for because you really don't know what you're going to get, and there's only so many ways you can study for that. So everyone has a different experience. All right, so then we'll talk about not underestimating step 3. So a lot of people will study less for this one because they think it's not as important. Not that it's not as important, but a lot of the times we're limited with our time, especially if you're taking it during residency, and then you'll hear right and left like, oh, it doesn't really matter, nobody looks at it. For fellowship, they just want you to pass, etc. And I'm in pediatrics, so we hear it all the time that it doesn't matter since it's not a pediatric exam. But if you do plan on applying for fellowship, and even if you don't, you always want to score as best as you can. So it's always good to just give it your all anyways, and use it as a strength and not a weakness if you do apply for fellowship. Big thing is to give yourself a lot of time to prepare. So if you're studying for this before residency, it's kind of the same thing like you would with step 1 or step 2. You give yourself 4 to 6 weeks, depending on what you need, maybe a little bit more. I know for me, I took step 1, 8 weeks. CK, I used 6 weeks to prepare for. But for step 3, I actually gave myself longer time with less studying, because I didn't actually have a dedicated period. And you'll notice that that kind of happens when you're in residency. So if you are in residency, give yourself extra time and set goals, and try to take a certain amount of questions a week, because you're not going to really be able to sit down and do 40 questions a day like you would if you were doing designated studying. And we can kind of talk about, we're going to talk about a sample schedule. I can talk about one when you're in residency, and then Neil can kind of talk about one before starting residency. Make sure you avoid resource fatigue. So there are a lot of resources out there, not as many as for step 1, but you do want to just stick to a few. There's some really good resources out there. Neil and I are going to talk about that. That's UWorld and the cases, and there's a CCS simulating, CCScases.com, which we're going to talk about, and then plus minus a biostat resource. But try not to go too far out. Keep your resources small. Make sure you study for the CCS cases. I know a lot of residents who will kind of wing it, and their score gets really impacted from that. They weigh a lot, and they can be very straightforward and raise your score if you just put in the time that you need to practice them. Utilize practice questions, so make sure you have a Q bank like UWorld, and review biostats. Step 3 is extremely biostats heavy. You know from from the step 1 and step 2 that there's a lot of biostats on that. I would say it's even more on the step 3. So make sure you're definitely comfortable with that. Make sure, like Neil said, you know what your weak areas are and you focus on that, and study those topics. Anything you would like to add, Neil?
I think you nailed it. I think it's very important to understand your goal. Do you want to pass? Do you want to crush it? I think it's an important point to think. Step 1 is going to become pass fail next year, and so you lose one component, and especially for those IMGs who are looking to add to their competitiveness, this is a tough test to take if you haven't prepared for it. But you can do well, and it can be another great point to your application to strengthen it, if you just put the time in and approach it the right way. Exactly. So I think this is a great outline to kind of get that started.
Mm-hmm. That's a really good point.
And so, establishing a timeline for this test, number of different ways you can do this, but just like Annette mentioned, have a plan. It's a little hard to wing this, but, at the same time, if you're in residency, understand that days may be longer than you expect. And so give yourself the time to account for life and work in between. And even before residency, many people are working or you're a medical student on rotation. So just realize that you don't have to be a superhuman to do this, work full day and then put in 6 hours of studying. Be realistic. The first thing we'll talk about is don't leave your test open-ended. This is one of those tests that's very easy to put off, especially a lot of my co-residents just kept on kind of pushing it off until you realize, wow, I got to take this. So if you set a test date, you have a clear time as to when you're going to be taking it. You can decide to take them back to back, or you can take them with some time in between. Test dates fill up, and I think with COVID now, there are a lot of people who were backlogged and couldn't take the test. So if you're taking it soon, try to snag a test date so that you know when you're going to take it. Be realistic about when you'll have time to study. So know what you're doing on a daily basis. If you're on a busy rotation in residency, realize that you may need some breathing room or some time. So give yourself extra time. Maybe you have a vacation coming up that you can dedicate to it. The time in between test days, I think, just know yourself. If you just want to get it over with, that's great, but it actually is nice to have a little breathing room. For many, step 3, you haven't taken a long test like that in over a year, and endurance is important. To do it 2 days in a row, it's my brain was fried after the first day, so I'm glad I had a week in between the first day and the second day. Practice tests, just like step 1 and step 2, they're super important here. There's only one practice test I would advise against. We'll talk about it later. And I'll tell you why I didn't listen to the advice of the internet in taking the UWorld self-assessment. But everyone, nothing helps more than practicing and knowing your enemy. And so knowing what to expect on test day, going through that mode and just being familiar will help reduce your anxiety, and you'll be ready for your test by the time you take it. So I think get your test date set, and then you know what to expect. You can set a schedule and build from there day to day. Annette, was there anything that you wanted to add in from your experiences?
Yeah, I just wanted to reiterate the fact that, because you said you took it over a weekend, right? So Friday, Monday?
I had a week in between.
Yeah. A week.
Yeah, a week.
Yes. So I definitely recommend not taking it back to back also. I had a weekend. So I did my first one on Friday and my second one on Monday. And it was kind of nice because I was in residency who was taking it. So I could kind of like have the weekend and like almost like a stretch of 4 days without, having work in between. But yeah, just like either 2 days or more, I would recommend between, because then you can really dedicate your time to the cases. And you could really dedicate biostats before, because biostats does not really show up on the second half. It kind of focuses in on the first. Okay, so here's a study schedule. This one is more of a designated if before residency. I'll kind of talk to you about my schedule. So I decided to take mine at the end of my first year, starting into my second year of residency. Every residency program is different. So there are going to be programs that require you to take it by December of your first year. So you kind of have to work with what your requirements are for your residency program and then work around the schedule that you're given. And I know in my first year, I didn't really have a choice of what my schedule was going to be. And we do 8 inpatient blocks in our first year. So it's a very inpatient heavy and very difficult. So I scheduled at the very end, and then I requested for my first block, the easiest block you can take in second year, which is neurodevelopment. And I was able to like use that kind of as a designated time. So try to plan ahead. If you already have your schedule, then try to schedule it around a time where you have an easier rotation. Try not to take it during an ICU rotation, or if you have back-to-back inpatient blocks that you know you're working most weekends and you're not really going to have time to study. And then if you do 24 calls in your residency program, you can use that time to your advantage. If you have like a slow night, you can actually do a couple of UWorld questions and take advantage of that free time. But the key, and like Neil said, plan ahead. So if you know that your test is 4 months away, start doing UWorld questions. Your goal should be to complete your UWorld block by the time you take your test. So if you know your schedule is rigorous, then you need to start earlier to get through all of those questions. Neil, do you want to talk about if your study schedule for before residency, if you're taking it?
So, you have to realize for me, it was over a year. I did research years between medical school and residency, and this was one of those things that I just wanted to have done with, just to be able to say I checked that box and it's done. So I hadn't taken a test like this in a while, and so I realized, well, wow, I'm not seeing patients every day, and so I need to practice, read. And get back into that mode. So I think I wanted extra time, and getting back into UWorld, I think resource-wise, this is one of those tests that you really want to streamline. You don't need too many things to prepare for this test. UWorld does an excellent job, and so those questions, just giving yourself time to work through them. Especially even thinking from a residency perspective or prior to residency, you just don't have the time often to take 6 weeks completely off and dedicate your life to preparing for this test. So fit in that time. I think you probably know how long it takes you to get through a block, and so I like to take at least 2 blocks and then review them, and that's a dedicated chunk. So be realistic. I gave myself maybe 3 or 4 hours realistically every day to study for this test after working during the day. And so I probably had about 5 weeks to prepare for it. And, I probably ended up maybe doing 4. You need that. You need to breathe. You need to understand and study. And also take a little bit of time off to not burn out, because this test is very easy to do that since you haven't been in student mode in a while for many people. So plan, and build some breathing room in. Understand that, maybe you're going to want to blow off a day just because you're burnt out. So give yourself that time. And if you're not so connected to the clinical realm, understand that you may need to go delve back into topics. So I think UWorld does a great job of that. But the CCS cases, which we'll talk about, are also a really good way to review step by step, medical practice. I think 4 to 5 weeks is ample time if you plan ahead of time what you're going to be doing.
Neil, you mentioned that you did UWorld and you did the CCS interactive cases.
Yeah.
The UWorld and the CCScases.com. Did you use any other resources?
I had planned to. I was not taking the initial advice of streamlining resources, and I ultimately found I didn't have time to do anything else other than UWorld and CCS cases. And I think that was more than enough in hindsight.
Definitely. I think if you get through the entire UWorld QBank, then you're good. The only other resources I would recommend is if you feel like you're weak at biostats, UWorld actually offers a biostats review, which I thought was pretty good. And it's not too expensive. Pretty fair considering the cost of the actual QBank itself. And then I also did use my first aid book from step 1 just as a reference. So as I was going through questions, if I wanted to recall a topic, I would kind of just glance over at my step 1 first aid, and I've found that one to be useful all 3 board exams.
Now that you mentioned that, the first aid, I do recall using that for the biostat section. I thought it was actually, it's only a few pages, but it was very high yield nuggets. Every single one of them come up, and as do their equations too. And it was a bit nice. Looking at that book again got me motivated. to really want to do as well as I can on this test. And another thing I just remembered was for topics, I guess that, again, I was a little disconnected from medicine every day. And so I had video resources, the online med-ed course. I think did some nice primers, which were easy to just listen to while commuting, just to review a topic, any cardiac things. And I'm in orthopedics now, so I know everyone just assumes we consult everyone for everything else. So I pretended that way too, and it was great to just go refresh yourself on topics. So take the time to delve into a topic. If you just feel a little weak or just want to review, it's only going to help.
And then the other thing I want to mention is that depending where you are in your I guess journey, you may be at a more of an advantage or a disadvantage than someone else. So I think it's a little bit harder. At least the CCS section is a little bit harder if you haven't started residency. Once you're in residency, you kind of have a better understanding of managing and diagnosing and what things you would order. While before residency, it might be a little trickier. So if you're a student who isn't in residency and is planning to take it before residency, you might want to spend a little extra time on the CCS cases and anything that requires like managing a patient. If you're in an internal medicine residency, I would say you're probably at the highest advantage out of everyone. I remember when I was studying for it, I was like, oh, I know I would have gotten this right if I was in an IM residency. But then, of course, I did very well in the pediatric cases. So like Neil, you said in a few slides previously, know your strengths and weaknesses when you study for this. Alrighty. Neil, do you want to talk about the CCS cases and some tips?
Sure. So practice is important. Once you have your schedule figured out, when you're gonna do this. Personally, I know that I like to kind of go from one mode to another. So I had a week in between my first test date and my second, and so I didn't do any CCS case practice until that week, because you've already been doing practice questions. You can kind of maintain a little bit of that in that week, but you can really focus on the cases, understanding how to work them, realizing what kind of steps to do. This is very similar to Step 2 CS, and understanding the software and how it works is a really big component. And you really just won't understand what we're saying until you actually go through it yourself. It is all about, the timing. Some softwares will even include a gap for time delay, which unfortunately is a real thing on test day. And so just understanding the beast is really important. So figure out when you're going to do that. I took that week to do all of it. I felt that a week was, more than enough, but that was my main component. If you're mixing it up, try to do 1 to 2 cases a day just to keep yourself exposed. You'll either have a 10 or a 20-minute case. There's no good way to predict what distribution you'll have on test day. The cases also end at variable times based on how you perform. Sometimes you'll perform well and you'll be done in 5 minutes prior to your time. Don't be alarmed. And that's where practice will come in too. So you just want to really be familiar with it. UWorld has a component. They may have changed it now a little bit where it's a little bit more interactive and you get some feedback. But when I took it 2 years ago, you had 30 plus cases, and it was just kind of text to review yourself, almost like looking through a PowerPoint. And then I like the feedback mechanism where I can enter my orders, do my test, do my case, and then get a score. Each one has its pros and cons, which we'll get into a little bit later. But ccscases.com is a resource that we'll talk about on the next slide that you can get that feedback from. And remember, in medicine, a differential is the most important thing. You want to nail down one diagnosis and just chase that, because your differential is also a way that you can kind of cover your bases. What am I looking for? What should I order? What should I think about? And again, if you're not doing this on a daily basis, take a little bit of extra time to practice and get into that mentality. It'll help you when you're ultimately a resident too. Right off the bat, you want to decide, is this an acute situation in that something important and a lot is warranted right at the onset? Or am I looking at kind of a maintenance case, someone that I may see in the office over the course of a couple of months? Timing is important too, and this is again where you want to practice it, because if you haven't dealt with long-term care versus acute care, or realizing when chronic care becomes acute care, this is where practice is really going to come in, and the cases do a really good job of preparing you for that. When considering a surgery, for myself, this is almost reflexive. What do I do for a person? I have a checklist that you just get through. It's almost like checking boxes. It's algorithmic. But when you're doing a case that may need surgery, there are just some simple things that you need to make sure that you do. Patients shouldn't be eating NPO. There's certain pre-op labs that are necessary. Whether you argue philosophically about why they're necessary or not, this isn't the time to do that. Just understand that there's some things you have to do, and make sure you've checked those boxes. And then something that we should always do is counsel patients, not just on what your diagnosis is, but some general health principles too. So remember, if you're talking to a teenager, there's certain counseling you may do. If you're talking to an elderly patient, there's other counseling you would do. Nutrition, smoking, screening is a very important thing. If you realize it's a patient over 50, talk about, have you gotten a colonoscopy? If you smoked before and you're a certain age, have you gotten your screening for lung cancer? So those things are great ways to score points, and get back into that mode of, helping the patient overall and not just getting through the main diagnosis.
So I think you did a great job summarizing that. Definitely. And then the part where you say it was like very reflexive for you to be prepping a patient for surgery, that might not be the how you guys feel, especially if you haven't started residency. So that's why it's like would be really important to study these cases well, because you have to know exactly what I have to make a patient NPO, and I have to order coags, and I need to order some imaging before they can go do surgery, and we have to consult the surgery team if we're going to go in and do a surgery. And the CCS Cases, the simulator actually grades you on all of those things. And that kind of brings me to my next slide. The reason why we like the CCS simulator is that you'll get actual feedback on the things that you forgot to order. And especially, and then that's when you'll realize like, oh my gosh, I didn't order thyroid studies for this patient. Or this is a female coming in with abdominal pain. Like I need to have a pregnancy test. I need a pregnancy test for all females coming in for any acute emergency. And so by doing these cases over and over and getting incorrect answers, that's how you learn. And I took step 3 just recently in July, and UWorld still didn't give any feedback still. So this is a very recent thing that they've been giving any kind of feedback. So CCS Case Simulator is amazing. It's only $70. It gives you 101 cases, but you can try out 2 cases for free. And it's really cool. So you can kind of get an idea of what the simulator is like. And so that's what I did. I went and I'm like, okay, let me just try these 2 cases, because I was really unsatisfied with the cases I had done on UWorld. And then after I did the 2 free ones, I said, yeah, we need to do this. One caveat is that you're on real test day, and I learned this the hard way, it is a little laggy, glitchy, and slow. So, and I think somebody told me that the CCS Case Simulator, you can actually lag it.
Yep.
There's an option, which I didn't know when I was studying, but for you guys to know, I would use that option, because on the real test, I was trying to order so many things that I was used to ordering really fast on my high-speed internet on my Apple computer, and I couldn't do that on the real thing. So then you can kind of familiarize yourself with what is the most important, because you're not going to be able to order everything. And so, yes, so they have 101 cases. What I actually did is when I kind of didn't do well on a case, or if I didn't feel like I did as well as I could have, I actually kind of typed out a summary in an Anki card, and I studied the case later. And because I only had 2 days in between my first portion, my second portion, I was doing 1 to 2 cases as I was studying and doing questions. Not necessarily every day, but every couple of days I would do 1 or 2 cases. And I thought I thought it was helpful in like breaking up my schedule and kind of doing something a little more fun. than just like URL question after URL question after URL question. So they can be kind of fun. I really enjoyed the cases, and the actual test day goes by a little bit faster, even though it actually ends up being about the same length, if not longer. Actually, it's a 9-hour test instead of the first part was a 7, so it is longer, but it doesn't feel as long, which is nice.
Yeah.
Anything you want to add to Neil?
One thing I remembered about the software that I'm glad a friend told me was that you will pay a fee. Remember, you're investing in your future, so it's okay, I guess, if you can swing it. But you can only use it on one computer. So whatever you install it on, that's got to be the thing that you carry around. So just keep that in mind if you're going to be working on that. The grading. So UWorld is great. I felt about going through the appropriate things. That one's kind of like a well filtered. What do I order? What's important to talk about? And it's nice to review, but you don't get the feedback mechanism. On CCS cases, I recall, wow, it seemed like I just have to order all these things. Why do I need a thyroid test in someone going for surgery? And I remember just thinking, why would you need that? And I realize now as a resident, sometimes, well, this is a new patient. We've never had them in the hospital. Even though, the thyroid function panel may not be so related, it's great to have a baseline on some of these people. So some of the things that you're ordering maybe for down the road, some of the things are just order them because they're important, and this test stresses getting certain things in certain clinical scenarios. And CCS Cases does a really good job of preparing you for that, from the pre-op or the diagnosis, then what's management, then what's preventive care, and what's downstream, maintenance care. What can you do? Go through those. If you feel like you don't do well in just absorbing it, I think Annette made a great point in saying, write them down, make a flashcard for yourself. If you're an Anki studier, that's a great way to do it. If you're old fashioned, put it on a piece of paper or index card and flip through them. Great things that you can do when you're super tired at the end of the day and have 20 minutes in bed that you just want to try and be productive with. Just go through some of that stuff.
Yeah, and then the case simulator is also really good about dinging you if you don't do correct counseling. So we kind of talked about it before, how important it is. So if you have a patient who's above 50, like Neil said, you need to get them a colonoscopy. So you would schedule that outpatient later when you get to your last, I think it's the last 2 minutes where you do your counseling section. So by doing these cases over and over again, it's going to be like second nature. Oh, this patient's above 50, I have to do a colonoscopy. Oh, this person's above 23, I have to do a pap smear if they haven't had one. This patient is a teenager, I need to give them an HPV shot. And even flu shots, they're always fair game.
Yeah.
So it kind of just gets you in this rhythm where it just kind of becomes second nature. And when you get to the exam, you don't even think twice about the counseling. And then it also helps you get more comfortable with whether the patient is acute or more, and whether it needs to be managed in an acute setting, like a hospital setting, ICU, or outpatient. So especially if you're not in residency, this simulator actually helps you get comfortable putting your patients in these different domains.
Yeah, I recall you had to pick a time. So if you're ordering a colonoscopy, well, when do you have them do it? When do you have them follow up? And if that's foreign to you because you're not doing it on a daily basis, you want to practice that and experiment on the software, a practice software, rather than experimenting on the day of the test. It's just a lot of it is being familiar with how the software works, and this is going to really let you hammer that down so that you're ready on test day. USMLE or the NBME also has software for you to experience the real test software, which I'd recommend downloading. There are a couple cases you can practice, try it out. There's also the practice questions, just like step 1 and step 2. A couple of those always show up on your real test, so it's nice to get a few freebies. But just experience and practice here is really important. So use whatever you can. That's another resource you can maybe spend an hour or two on.
Exactly. Perfect. So Neil, do you want to talk about our case example?
Sure. So, we'll go over this case and some of the things that you can do, things that you should think about ordering, and take it from there. So, a 23-year-old female presents with right lower quadrant pain. It started 3 hours ago. The pain initially began in her umbilicus and later migrated to a right lower quadrant. It's also associated with nausea, vomiting, chills. She has no significant medical history aside from endorsing smoking half pack a day. So the first thing anytime you should do is try to approach what's my differential, and based on that, I like to kind of just think of 3 or 4 diagnoses, whether I'm right or wrong. It gives me something to work towards, and I think just working towards a few different diagnoses will help you cover all your bases. So what are we thinking of here? We're thinking of right lower quadrant pain in a female. So first we think of our diagnoses. Is it appendicitis? Is it, could it be, this is a woman of childbearing age. So could it be some sort of ruptured ectopic pregnancy? Try to avoid some of the more esoteric diagnoses, go with the more common things. These tests are all about what's obvious. Go with the more obvious things. Don't chase the esoteric things, and work towards those. So we have a diagnosis in mind. We have some symptoms. So what are some labs that we'll think of ordering when we're having these symptoms, and then remembering this is a patient of a certain age group. So what is some counseling that we can do specific to this diagnosis? They give you a little tidbit here about talking about smoking, about giving you the age. So we think about those when we think about our acute counseling and our maintenance counseling down the road. Do we want to go through a little bit of what we should order here, or should we kind of take that by a slide-by-slide basis?
Yeah, let's do that. We could do slide by side or slide by slide. So just to touch base, it is this as straightforward as Neil said. A lot of these questions are pretty simple, and the diagnosis is obvious. Sometimes I think you'll get 1 or 2 where it's kind of questionable and a little bit tricky, and that's when you kind of want to have your broad differentials, because if you don't end up figuring out what it is, if you do order a lot of labs and things that are broad, you will still get the points even though you don't technically get the diagnosis. So that's always good to know. But it is as simple, and you do want to know how to use the software. So we can use the chat box here. What would you guys order? So 23-year-old female, she has right lower quadrant pain. It started 3 hours ago. Umbilicus migrating to the right lower quadrant, nausea, vomiting, chills. Okay, NPO ultrasound. Ultrasound of what? Because you have to specify.
Right.
Okay, so NPO is good. Yes, you want to get a pregnancy test. Pelvis, right lower quadrant.
Excellent.
Exactly. So abdominal and pelvic ultrasound is what I would order.
And then, we're talking about some nausea, vomiting, and chills. So with nausea, with vomiting, and also in someone, we're talking about NPO, pre-op workup. So what's this patient's electrolyte status? What's going on inside their body? So labs, perfect, exactly. So we've got some of those labs in preparation for what can we do to optimize them, where are they at, and then what do we need to know before any sort of possible intervention.
Exactly. I love the CRP also. That's a good one.
Yeah, I love it. I love when people order the CRP.
PT, PTT, great. Yes, coax, because if you're thinking appendicitis, this patient's going to be going to surgery. So you're already doing your pre-op. Beautiful. What about, so nausea and vomiting and pain? What about what the patient needs? Think about medications. What medications would we order for this patient?
Do we give them IV medications? Do we give them oral medications? Would you want to give someone who's vomiting something orally? So type of medication, that's great. Symptom control, maybe a little Zofran could help.
So I was waiting for Zofran. Good. Exactly.
And it's very easy as residents. A lot of these are sometimes order bundles, depending on what EMR you have. You just type in, I don't know, pre-op. You can make your own little order set. pre-op, and after that it's just, oh, I just order this. But for those of you who aren't in residency, and for those of you who don't have the luxury of great EMRs, some hospitals have different ones, you've got to actually remember step by step, what do I need to get? And so this is where you'll really hammer that in and make that routine for yourself.
Exactly.
And then what about counseling? You know, okay, 23-year-old female, you know, after we've stabilized her and figured all this out, what are some of those last little icing on the cake things that we can do after the acute situation is taken care of? Love it. Smoking cessation, always a good answer. Pap smear, that's awesome. Yep, sexual disease screening. Safe sex counseling, that's excellent.
Awesome.
Great. No, I think you guys have covered a good amount of and you notice how kind of broad all these things that you're ordering are. You know, you don't want to do them all right off the bat, and the software really prepare you for, what do I need to do now? What can I add in later? And it's a little bit forgiving if you forget something. You know, throw it in later. Remember, this is all software, and so it's not necessarily grading you on the real-time development, but at the same time, it helps to do that, because sometimes your case will end before you get the chance to do that.
Perfect. And then what about physical exam? Because they actually do get you guys to mark off the physical exam.
Physical exam.
Which ones would you guys pick for this? What would be like your top 4? Because if we're thinking something, so McBurney rebound, so that would be abdomen. Perfect. Yes, so definitely respiratory CV. Anything else? Okay, good. I would also say probably a general exam, because she's a female, it could be a pregnancy. That would be a good one. Vital signs always. Awesome. You guys are really good. You guys are doing great. So you'll see, it's kind of fun, right? To like answer these questions and kind of think like a physician, because this is what you guys have been training for, and this is what you're gonna have to do one day. So it's really, I think the cases can be pretty fun. Good job, you guys really killed it. And so this is just kind of a summary of what Neil and I kind of mentioned, and all the different labs we would get. Your analysis, oh, I didn't even think of that one. That one's
culture
really
workup
good.
or fever workup, right? So those are also important.
Right. Exactly. And so those were like the more just general things I can cause about abdominal pain. Perfect. So this is kind of what we already talked about. Would you remember to make the patient a PO? Would you remember to consult the surgery team, order an IV access, give the patient pain medications, start them on antibiotics, and know what antibiotics you would give? So the CCS cases will actually give you a whole list of antibiotics that would be acceptable, and then you can kind of memorize the ones that you're more comfortable with, assuming if you don't already like feel like you know them well. Perioperative labs, would you transfer the patient? Because that's an easy thing to forget, from the ED to inpatient, or do
from your office to the ED. Yeah.
Exactly. And then the counseling.
You know, I think this is also a great thing to remember too, that if you're a resident, you know, this may be a good time to sometimes unforget some of the institution specific things you do. You know, some hospitals use specific antibiotics based on whatever their kind of antibiotic regimen is, or preferences are, regional preferences are. Sometimes in medicine, we're a little guilty of, well, you do it because that's what we do. But remember, this is you're thinking about standardized medicine here. So the CCS cases helps you go over some of the general things that you should be. So what are broad spectrum antibiotics that you should put someone on? And you know, what are the standard ones that the exam is looking for you to remember to include? So that's where this practice is really going to help.
Exactly. Great. All right, so just some pointers. The whole exam point of this, especially the cases, the whole point of the cases is that you are comfortable managing a condition, and that when you're in your practice, you kind of have an idea of what to order and how to manage. So we kind of talked about that. You want to do practice cases often. I always said, like I kind of mentioned before, it's a nice way to break up your questions. So if you are a student who, like maybe you only have 2 days before the second and the first and second, or you're taking it back to back, which some people might choose to do, or you just aren't comfortable with the cases, do them more often. Maybe go through the simulated cases twice, maybe make a flashcard deck. But you have to know your strengths and weaknesses and try to get through at least all of the cases at least once for the CCS case simulator from the cases. The more you do, the more comfortable, the more second nature it's going to be, the more you're going to enjoy the cases on test day, and they'll be more fun and the time will pass faster. And we kind of already talked about spacing your exam out, but we really do, Neil and I recommend it, we strongly recommend that you space it out more than 2 days as much as you can. Anything you want to add to this slide, Neil?
I think you covered a lot of it. So, just practice, practice, practice. This is all about getting reps in. And the more reps you do, the more routine this may seem when you're going through it. And anxiety kicks in on test day. And so just knowing what to expect is going to help get you through that final kick. I couldn't find a place to verify this, but I remember a number of people telling me that the CCS portion kind of scored for about 25% of your step 3 score. And so it's a really significant portion that you can use to boost. I knew as someone doing this before residency, I think I'm going to struggle on some of the questions that involve kind of being reconnected to medicine, kind of being in tune with what do you do with medical patients. Long-term management was something I didn't have practice with. So this was a nice way to really hone in on a section and boost your score. And it can be fun to get through. If you don't practice them, you're just going to be miserable in this last segment of step 3 on that final stretch. And I think, that may lead us to the kind of next thing that we can talk about is things to avoid in preparation for your test day. So not doing at least one pass through UWorld. I mean, UWorld, we all know is dogma. It's one of the best resources. And if you can get through this, you've at least put in the minimum amount of work that you need to prepare for this test. It really exposes you to a lot of what will come up, both for the practice questions or for the test multiple choice questions, as well as for cases. So try to get yourself through that. An unrealistic study schedule. So if you are on a busy inpatient or a consult rotation that's a month long, and you say, I'm going to crank through this in, less than 4 weeks, maybe I'll give myself 2 weeks to study for. I know the old adage was, 8 weeks or 2 months or 3 months for step 1, 1 month for step 2, and a number 2 pencil for step 3. But that's not necessarily the case. It may have been, and that may have been a nice day. But the step 3 exam is the real deal, and it's a 2-day grueling test, and you don't want to have to do it again. So give yourself time to prepare for it, and anticipate that life will come up. Try to build that in. That's an important pro tip for residency too. Life comes up, so give yourself time to account for that. Overthinking the cases and not focusing on questions. This is where the software as well as just practice will help you hone in on what you may do. Do you question yourself? Well, go through the practice cases. And when you notice that your scores are changing by you modifying a behavior that you're doing, that's real-time feedback that's very helpful. So do those, but don't forget questions are about approximately 75% of the test. So that's important to get through too in power. Deficiencies, they're common things. Everyone likes to ignore biostatistics or ethics. You just assume the ethics questions you'll figure out because you can't really practice for. Again, remember first aid has a section on ethics that you can go over common ethical issues that come up in medicine. UWorld has great practice questions in biostats. The UWorld resource that they have is really excellent and covers most of what you need. I think the final thing over here is pushing back your test date without a clear reason. Some people have a very specific reason. There were people who were scheduled to take step 3, and then the COVID pandemic struck. They had no choice but to push their test back date. Or, perhaps something happens in life where you have something come up health-wise that you just can't take it. If you're sick, maybe you don't want to take this test when you're really sick for like a week and you lost your momentum and you think that's important. Okay, talk to others and see if maybe it's a good idea to push it back. But if you just keep on pushing it, it's one of those easy things that's easy to push back. But realize if you schedule a date and you're working towards that, you're probably going to be reaching your peak. There's a kind of a law of diminishing returns, and you just don't want to prolong this. Reach your peak and get the test over with. And remember, it's expensive to have to push it back and buy a new permit period. So, you think about your pocket too, because, you are investing in your future, but there's only so much capital to invest with when you're a trainee, right? So, all these things are important to kind of remember. Annette, anything else that you think you want to add in or share?
I think you did an amazing job summarizing this slide and talking about all these different points. So I totally agree with everything you said. Last thing, we'll jump into the the Q&A, since I know we've been taking up a lot of your time, but we really appreciate you guys coming out today, and we hope that this has been really helpful for you. The last thing I kind of want to mention is med school tutors, and we kind of mentioned what we are about, but just to kind of reiterate that, we are a one-on-one tutoring family here for you, family of tutors who are here to customize a study schedule to meet your needs, whatever they may be. I see there's some people studying for step 2. So we offer step 2 help. We offer step 3 help. We offer residency advising help. We offer fellowship advising help. We even offer help for when you start studying for your boards beyond the USMLEs. So MST is here for you. We're geared for whatever need it may be. If it's something that you're not sure about, reach out to us. We'd be happy to answer any questions. Our administrative team is amazing. Faith is actually on this webinar right now, and we love her, and she's so great at answering questions. If you have anything that revolves around like a custom study schedule of any type, please feel free to ask any questions you have. We adapt our tutoring sessions for you. We match you with a one-on-one tutor that is fit for you, that matches you. It's a good fit personality-wise, and also with exactly what you're looking for. If you want more of like a coach or more of like a drill sergeant type tutor. And our tutors are amazing about communicating outside of your sessions. I know for me, I'm always contacting my students. I have 3 residency advising students now, and I'm always like, hey, did you submit your application? Hey, how are you doing with this? Do you need me to do one more like review of your personal statement? Like always communicating. And then not just your tutor communicating with you, but also administration communicating with you. And we're really here to provide you with accountability, to provide a mentor, a coach to you, and support and guidance for whatever that may be. And then also, if you just need like a one-time session, we offer that. A strategic planning session, maybe it's just coming up with a schedule to study for step 3, we can do that as well. And then also for ERAS, consulting and certification.
And if you don't know what you want, the advisors here and the administrators are really helpful in helping you figure that out too. So if you're just you feel lost and you want some guidance, they can really help connect you with someone who will be able to help you identify and get to what you need.
Exactly, perfect. Alrighty, so let's jump into our live Q&A. So I know a bunch of people have already asked questions. We're just gonna start reading some of the questions. Neil and I are gonna just bounce back and forth, and we're gonna just jump right in, all right? So if you guys have any more questions or wanna reiterate a question, please go ahead and just ask. Okay, so question I have here. You mentioned how the case could end quicker than you think. Is that because you're performing poorly on a case? Could you please elaborate on that? Thank you. And how many cases are there? So there are 13 cases on the actual thing. And there's 101 plus the 2 freebies on the CCS simulator. So for the actual test, you want to know 13. Neil already kind of touched base on this, that the cases could end because you oftentimes it actually ends because you got the case right. So for example, this appendicitis case that we kind of gave you as an example, if the purpose of this case was to just identify that this was appendicitis and send the kid to surgery, or the person to surgery, sorry, my brain is pediatrics, so send the patient to surgery, then the case is going to end as soon as you, one, diagnose appendicitis, and the way you diagnose it is obtaining the correct imaging. So we talked about that, ultrasound of the appendix, ultrasound of the pelvis, and then you identify it, you put them NPO, you get your pre-op labs, you start your antibiotic and you send them to surgery, your case is going to end, and then you have your 2 minutes to do counseling. And that means that you actually did exactly what you should have done, and your case ended early because you basically did perfectly on it. So in my experience, cases tend to end early when you get them right. A lot of people freak out and they think that if it ends early, you messed up. And I think that's totally the exact opposite, at least in my experience with the simulated cases. Anything you want to add to that, Neil?
I think doing the practice cases will help get you there. Remember, this is kind of an artificial situation. So yes, while you're in the emergency department with someone actively vomiting, and you're trying to figure out what to do, maybe that's not the right time to counsel them on stopping smoking or offering them a pap smear. That may be something you do after you've kind of stabilized the acute situation, but this is software, it's not perfect. And it's kind of a test to make sure that you know what you should be answering. So yes, you may be able to add those into your software, either as you remember them or just as you're kind of getting through the case. But the software will really help you practice the step-by-step. Let me get the acute stuff out of the way, get this person stable, and then I can take care of some of the chronic management. And I think we talked about, there's 13 cases. You've got the 101 cases, the 2 freebies that you get, and then UWorld, I think, has like somewhere between 30 and 40 cases that they're good cases, and there's good content in there to review. It's just very tough to review it as you're almost reading a book rather than, having some sort of interactive feedback.
I think I saw earlier, is doing step 3 for step 2 CK recommended or not? I don't recommend studying step 3 material for step 2. Stick with step 2 material for step 2. I think the most that, like, I've heard of people using the Kaplan, I think, review book as like a supplement to studying for step 2. I personally am not a huge fan of the Kaplan review book. I think if you're going to use any resource, you should use first aid for step 1, but that's just me. If you do like the book and it's a good supplement to your questions, then that's fine. But if you're studying for step 2, study for step 2, because you don't want to be, first of all, there's not really much time to do that. By the time you get through all of the UWorld for step 2, you're really not going to have time for step 3. And then step 3 is a lot of management. It's very out of the scope for step 2. So you want to go in order. And if the better you do on step 2, the better you're going to do on step 3. So focus one exam at a time and focus your attention on step 2. And like we mentioned already, there are tutoring resources for you. So if you do feel like you're struggling for step 2, we have a lot of tutors available to help you in that regard.
Looking at some of these questions also, so extra measures, screening, and counseling. Yes, they'll improve your scores because they're showing that you're thinking about things outside of what your current diagnosis is. And so again, hammering those details down through practice cases is where you'll kind of make them more of a routine thing that you recall to include in your test, and how to order them too. Normally you just talk to someone about counseling, or you counsel them on it. Now you have to actually type in counsel on that. You'll also realize the text is a little variable too, so it does allow for kind of a degree of freedom of how you type it out or how you include it. What else? I think higher scores on step 3. Sure. Again, with the algorithm changing, I think this year is going to be a unique application cycle with a lot of virtual interviews. And next year will be another unique cycle because step one is going to be a pass-fail test. So anytime you do practice, or anytime you do a standardized test, I mean, a lot of you are in medicine and a lot of you are high achieving people. And you may just want to do well for your own personal sake. You know, you're going to take this test, you're going to go through it, you know, why not try to do the best that you can? And it is a marker that comes up when you have to put it down on later even orthopedics, you know, I'd say just like Annette mentioned in pediatrics, you know, it's more of a checkbox. Did you pass it? But you know, maybe you don't want to drop, you know, 30, 40, 50 points from your step one and your step two to step three. You know, it may show that you just kind of prep for it just to pass. So it is good to take a little pride in trying to do the best that you can on this. But I think a higher score will help. You know, it may not account for a lot of other weaknesses on an application, but it can certainly help answer questions about someone who may not have done so well on step one or step two.
I 100% agree with you with the whole confidence thing. I took it at the end of intern year, and I am sure if you're in residency, you guys are probably feeling this now. And if you have it, you're going to. First year really kind of like kicks you to the ground, and you kind of like start over, and your confidence like kind of like you feel very defeated after first year. At least I did. So studying for step three, relearning that information, doing well on the exam, it gives you a new sense of confidence. And it shows you that, you know what, I am a competent physician and I am ready to practice medicine. And so that's always a positive thing. And then when you do well, you show yourself that, you know, and it helps you get through second year and build that confidence that it's really important when you're a physician. Also, I took it in July. It was right before my pediatric, we do like our pediatric board, like practice tests every year. And studying for step three helped me study for that. And then I did well on that. And so that's just setting you up for success. And then now you can look forward to like your fellowship application and use it as something that's a positive and not something that's like, oh, I just passed. So I always recommend just do the best that you can and try to score as well as you can. And if you don't score as well as your first step one and step two, it's not a big deal, but you should always shoot for the stars.
Mm-hmm. Yeah, aim to make sure that when you're taking it, you pass. And you know, again, when to take it to, timing wise. You know, Annette, you mentioned you took it in July. I'm kind of glad I took it before residency, but even, you know, every institution is different. Some require you to take it by a certain time. Our institution actually requires you to take it by the end of your second year residency. But I know that you know, I spent 12 hours in the operating room yesterday, and at 10 p.m. started field through 8 consults that were just waiting for me on call after I got out of the operating room at 10 p.m. So I can't imagine trying to study for step three after, you know, such a busy on-call day during my off day the following day. And so if you know that you can get this out of the way before you're going to be busy in residency, it's one less headache to plan for. Kind of changing gears, I know we saw a couple of these questions before that about the drug ads that we mentioned. There's also abstracts that will come up. Those are two of those kind of weird questions that you're not sure, you've never experienced, but that's where UWorld really does an excellent job in exposing you to those. You look at a drug ad and it's a lot of content to take in, and sometimes it's a multi-page ad. You know, me personally, I like to actually look at the question, see what it was asking, and then go find what it was in the ad. Because I just found looking at the infographic so overwhelming, because there's a lot of details in it that may be important, maybe not. So I let the questions kind of guide me as to what I'm looking for. The abstract is also something that, you know, some of you may not be exposed or frequently seeing, where you read a scientific abstract and then you have questions based on it. But if you go through UWorld, they have a lot of good and a good number of examples to really prepare you for how to go through a drug ad or how to answer questions based on an abstract.
Did we answer this question? When should we worry about the order of things to do? I think we kind of like touched base on it, but I'll just reiterate it again since I saw that Sonia put it twice. it's basically you always want to start with your physical exam. So that order matters. And then you kind of want to go in like the order of what you need to do to diagnose. I don't think the exam is going to really mark off. Yeah. So Neil, you did mention, you did answer this question. Sorry. So you want to do counseling at the end, and you want to do your physical exam first, and you want to do your diagnostic workup in between. Okay. Sorry about that. I got a little confused for a second. Okay.
Okay.
Okay. Any other questions that we may have missed?
So the pharmacology, I guess Cole asked about pharm popping up. Certainly can help. That was one of those other sections. First aid for step one had a lot of good kind of primer tidbits in there. So, sympathetic versus parasympathetic mechanisms, things that you just haven't seen in a while. If you have time flipping through those, it's not a bad idea. Again, you want to streamline the resources. A lot of people hold that first aid near and dear. I know I actually think my first aid is still somewhere in my bedroom in my parents' home. And while I'm glad I never had to look at it again, it is nice to flip through, just to kind of remind you, hey, you know what? I studied hard for step one. There's some good mechanisms in there that is nice to review. If you don't do it, you'll be okay. UWorld sufficiently prepares you for everything that you're going to see on the test. But if you have a little bit of extra time, sure, you can flip through it. But it's definitely not necessary. You can certainly read every resource out there in step three, and that could be beneficial. But realize you're balancing that between what your time availability is too.
Exactly. All right. Any last minute questions? All right. Thank you so much, guys. We really appreciate your time. We hope that this webinar was really helpful for you. If you have any questions, please don't hesitate to email us. Our email is down here below, hq@medschooltutors.com. If you have any questions about tutoring resources or actually getting a one-on-one tutor for yourself, please feel free to email us. If you mention that you participate in this webinar, you'll actually get a discount as well. So make sure you do mention that when you do call. So thank you so much.
Yeah, good luck to you all on your tests, and we'll see you if you get more involved with med school tutors.
Exactly. And then there's a quick survey that Faith posted in the chat. So if you don't mind giving us some feedback, we'd really appreciate it. So thank you guys so much, and we hope you have a wonderful
good night, everyone.